Okay, so welcome back, students. Now we are coming to chest discomfort. As before, we have learned about hypersensitivity reaction. Now, coming to chest discomfort. So, just let's say your patient complains of chest heaviness while reclining. Okay, so there's a patient in the reclined position and he's complaining for chest heaviness. So, what we have to do, we don't have to ignore it. Okay, so the thing. Okay, so here is cricothyroidectomy. It's a proper definition of cricothyroidectomy. Oh, one thing, just wait a minute. Okay, so that's how it is written. You can see that that it is. Just read it from here, and that's very important. Okay, so much miss here, but okay, just ignore it for some time. Okay, so the patient, this box is important for you guys. You have to understand it. The patient describes its pain as squeezing, bursting, choking or crushing. That's how he's gonna describe it, the pain. So retrosternal location, if it's in the retrosternal radiating to left shoulder, arm, neck, or jaw, it's something we call as an anginal pain. So that could be something, these are things to the neck mandible. That's are the symptoms you can see from your eyes. And also, or if he's associated with exertion, anxiety or large meals, so that's are the characteristics the patient is showing to you. And if you have given him, nitroglycerin and or given some rest, so it could be diagnosed as angina. Okay, so every time you see some patient having some characteristics, this is an angina pain. Okay, so but if it is suspected as a cardiac cause, then we have to do the same. Just stop all the dental work, place him in the semi-reclined position, okay, administer oxygen and give nitroglycerin. These are things if it's something related to your heart. It's something that's gonna come ahead, but I have just given that nitroglycerin is the recommended drug in the angina pain. Okay, so here we have another uh, box, and what it's saying is that not all chest pain is cardiac. Okay, so here's how you tell. That is sometimes what happens. The cardio common causes for the chest pains are angina pectoris, MI. For your GI tract, you could have a heat burn, acidity, tinea hernia, reflexive mucosystem. You could have some muscle spasm after having gym or some sports, physiological, maybe hyperventilation. Okay, so these could be the reasons. In common causes includes that these common could be the part of it, but they're not much common. So you have to learn these tools: pericarditis, dissecting aortic aneurysm. In respiratory, if someone is complaining pulmonary embolism, he could say that I have a chest pain, but it could be a respiratory problem. While you have to see in GI tract, he could have esophageal rupture, eclasia, mucosskeletal system, osteochondritis, and chondrionitis, all these things. So basically, that's how it is. You have to go through these boxes, and they're gonna benefit you a lot. Okay, so you have to understand what is the first cardiac emergency drug. So always remember that it is written down here, the nitroglycerin dose. The nitroglycerin is very, very much important. Okay, so here it is again, the nitroglycerin dose. In the next page, we are gonna give in detail all these. You have to go for this paragraph that the patient have how he's having these pain and how to relieve it. So now coming on the next slide, just give it a read to it, and just get learn these boxes. It's gonna help you guys. So the next page we're coming for now. Just imagine yourself you're in the middle of a tooth extraction when your patient clutches their chest. Okay, now what you would do? Okay, so now we have to talk through a life-saving protocol for managing chest pain, okay, in the dental chair. So okay, so coming over this, I mean, like, you have to give it a read. These are the same things described here, but these, the way they have summarized it is really excellent. This is something you have to remember all your life and for your exams. So, the first initial reaction when the patient is just having his hand on the chest, what do you have to do? Initial reaction, step one, as soon as the patient shows signs of discomfort, do these steps. Okay, so first things first, stop all the dental procedure. Sport. Stop is the sport stands for S for sport. T. S for stop all the dental treatment. P for position the patient in semi-reclined position. And O for administer oxygen. And R for reassure. And T for, you know, check his vital signs. So that's how it is. You have to learn this for all of the medical emergency, and it's gonna be so easy for you. So coming back to it, stop all the dental procedures, position the patient in semi-reclined position. Now start administrating nitroglycerin either in a tablet or spray form. Now give oxygen slowly over 5 minutes and take his vital signs. So that's our step one. So the step two is that step two. Okay, so coming at the step two, we have to see if the discomfort is relieved. The patient is now okay, and he is saying that I'm good now. So we have to assume it is as angina. Okay, we have to assume it is as angina. Now proceed with oxygen, modified treatment plan for sorry for that. That's it is. I just was looking down there. Okay, so if the now we did first step and the second step is reassess in the next 3 minutes. So if the patient has his discomfort relief, it's angina, and then we have to just proceed with oxygen with tapering it down. That's how it is. Now the discomfort continues. Okay, the discomfort is continues and it's not relieved. Now we have to give a second dose of nitroglycerin and also simultaneously monitoring his vital sign. You can give up to two or you can give up to 3 doses of nitroglycerin every 3 to 5 minutes, but only if the systolic blood pressure stays above 90. It's something a key point you have to remember for this. The step three is here. So in this step three, we have to understand few things that now we have to the discomfort still persists. Okay, it has not gone, it still persists. Now we have to administer third dose of nitroglycerin. Third step and the third dose of nitroglycerin. And we have to recheck the vital signs and call for the medical emergency because now it's getting out of our hands. So step four. The step four comes as now assume it's no longer just angina. Now it's not angina because it's still continuing, okay? It is still there. So what we have to do? Now assume it's no longer just angina, it's MMI, myocardial infarction. Okay, myocardial infarction, what to do? We have to now ask the patient to chew 350 352 milligram of aspirin. Okay, okay, so this is super important. Just remember its dose and what drug we have to administer in myocardial infarction. Okay, so now we have to, along with it, give a crystallized solution IV line. Okay, and if severe pain continues, then we have to titrate morphine sulfate 2 mg. milligram and give it IM IV every 3 minutes. So that's how it is. Prepare for transfer to the hospital and start BLS if cardiac arrest occurs. Okay, so also know the difference between an heart attack and cardiac arrest. That's important for you guys because heart attack is the blockage of coronary arteries and cardiac arrest is something related to the heart stops only. So that's how it is. uh like I have to give a a really life example to you guys for a chest discomfort. Like imagine a 60-year-old male undergoing implant surgery suddenly says my chest feels tight, and when he checks his BP, it's like 140 over 90. So what do you have to do? First of all, as I have said, go for sport. Okay, sport. What does it mean? That stop the treatment, position the patient. So the next step is administer the drug in what we give in cardiac patients, and that is nitroglycerin. Then 3 minutes later, if he still feels the pressure, you give a second dose. Okay, the second step and the second dose. At this point, you also monitor vital signs. Okay, we have to monitor his vital signs. If the symptoms still persist after the third dose, you initiate emergency protocols, and these are basically the emergency protocols. Always remember these are the emergency protocols given right here. So that's how it is, and I have to make over here as I did. So then you have to go for aspirin, morphine, and start an IV. Okay, so. Coming back to the chest discomfort medical emergency scene here, and you have to give it a read as well. It's gonna help you guys. Morphine sulfate discomfort. That is just a summary of no, it's like it is summarized here. So just to I'm not saying that don't give it a read, but just learn it by heart. You have to know this so well as it is very important for your exams and in your clinical life. It's gonna help you. So that's how it is. So some important things for exam is that you have to remember the first line for chest pain is nitroglycerin, and the dose you have to who said is 0.4 mg. Okay, it's 0.4 mg. Okay, and how many NTG doses, nitroglycerin doses you can give? Maximum are 3 doses, and they should be a difference of 3 minutes. And diagnostic sign of myocardial infarction is that if the patient says the pain persists after that 3 doses. Okay, you have to understand this point as well, and all these points are important for your exams. Okay, guys, so pain relief drug that is used in cardiac pain is morphine sulfate 206 mg. And why we have to give aspirin? The question is why we have to go for aspirin. So the reason is quite simple. It is an antiplatelet, reduces clot formation. Okay, so written here the aspirin, you have to understand that it's an antiplatelet drug. So that's how it is from our chest, or a cardiac emergency scene in the dental office. So I hope you guys got to understand something new from here, and you guys have to like it and for subscribe my channel and put some comments if I'm doing something wrong or you guys are finding it difficult to understand. So I have to do it again because my priority is you guys, that you get the best out of it. So thank you very much. And in the next part, we will go for the respiratory or asthma and hyperventilation emergencies in dental practice. We have to make it really simpler as well. Thank you very much.